Deep mapping in cancer makes all the difference. If you could only watch a corner of the road, you'd crash your car. That's how most cancer testing works today. A tiny view of a huge problem. But what if we had a drone that we can fly up above the tumor and see every little road, every pattern, and every part of the tumor so we can build a custom treatment plan? And then we can send in a SWAT team or the targeted care that works just for your cancer. That's how we knock out cancer, and that's really the key to precision oncology. I'm Dr. Dino Prato. For the last 25 years, my team and I have helped many thousands of patients who failed the top hospitals by using precision multi-omics mapping and targeted delivery. So let me go into this a little bit so you can understand this. The car, the driver, the SWAT team, I'm trying to use analogies to help you because it is complex subjects, but I think this will do a good job in helping you understand this. DNA is like the car. You can see it. Let's say we're above the city in an airplane looking down at all the roads moving. The car is the DNA. We can see that part of the cancer. And there's maybe a few hundred reads you can get with DNA, but there's only some drugs and it's not complete. So you might get, 50, a couple hundred markers, nowhere near complete. Then there's RNA. It's very powerful. It's transcriptomics. It's the driver in the car. It tells you what's driving the cancer, where it's going, where it might escape to, and it gives you the information on the treatment. And then there's a deeper level called spatial biology, immune profiling, where we can look at the immune system and why it's not responding or how it can best respond to care, because this is the key. If your immune system is doing what God intended it to do, you wouldn't have gotten cancer in the first place. The immune system is the first and last defense, and spatial biology helps us look at the tumor microenvironment to understand that space. So why does this matter? So the DNA is the car, the RNA is the driver, and we're looking at the spatial biology, which can help us bring in the SWAT team to kill the cancer. It matters because nobody is testing correctly. You're running either standard of care, which is just a tumor marker, biopsy, and imaging, giving you 24 markers and then guessing whether it works. And if you're lucky, your oncologist will order a DNA test, which will only give you a few hundred markers, but these are only using standard drugs to slow things down. They're mainly cytostatic. They're not cytotoxic. They aren't designed to kill cancer. They just slow it down. But there's nobody running the deep precision testing. So when you run this drone in the sky, I say looking at the tumor from above, and you can see all this information, you take the guesswork out. Now with precision, you know where the bottlenecks are, the detours, what's caused the cancer, and you can pick the therapies that are exact for you. Once you've done that, now the medicines have to be custom made because you can't just order these. You're going to find on-label drugs that are approved. You're going to find off-label or repurposed drugs, medications that were used for something else, but now work for your cancer because they have that mechanism. And third, phytotherapeutics are integrative agents that will support all of these treatments like neoadjuvants, a supportive care, so that now you got 1 + 1 = 5. All the pathways are covered. You have custom drug design. You can get right into the tumor with data and information and stop the guesswork. Now that we have all this, now we can deliver it in microdoses. We don't have to lose our hair, be fatigued. We can do this. You can see late-stage cancer patients. It's very clear. If you go to a hospital, they're run down, they're tired, they've lost their hair, they look just gone through the worst. And then you walk into precision oncology, what we do, and it looks like a patient's on vacation. They have color in their face, they have immunity, they're strong. This is the difference. And their responses are fantastic because the targets are correct. See, this is the key. And so now you can dial in the phytotherapeutics and cellular therapy. These are the biological cellular therapies. Your own natural killer cells, dendritic cells can be grown, typed to the tumor, and deployed so that it can help you if that's the right target for you. So you can see all of this and you can decide exactly from this as a physician what the right care is instead of guessing. And then we deploy it using GTF, which is genetically targeted fractionated chemo. That's like 10% of the normal dose. We don't have nearly as much toxicity, if any at all, but we get the benefits of care. Then we have CIPI, which allows us to use interventional radiology oncology to use a catheter the size of a hair, go right into the tumor, kill it, and come out, seal the blood supply, and create an immune system response. Then we have AAIT, which uses your own immune system, targeted towards DAMPs, damage-associated molecular patterns. They teach your cells where the cancers are so they can go and kill them, your natural killer cells and dendritic cells, understanding your immune system designed for you. This is the future of oncology. It's where it's going, but it's so slow getting to patients. We've built an ecosystem to get this to patients now in a manner that is powerful, getting the latest technology straight to the patient. So instead of carpet bombing and hoping something's going to work, here you can have precision targeted care. You can expose the weaknesses of the cancer, get the immune system activated, and make the changes that are necessary. Doesn't matter where you are. The sooner the better precision works in our clinical experience. And there's other studies like iPredict and Winter that backed us up, and our own work, where we basically in 2024 published that we had such a higher response rate, 35 times greater response than conventional oncology, standard oncology for late-stage cancer patients, and a 43-time better quality of life. These weren't percentages, these were times. That's many times improvement because of precision targeting. It takes the guesswork out. It allows for the right therapy, the right microdosing, and to manage the patients with the right care. That's been our clinical experience. When you have this data, you can see clearly why you're not responding and what you need to do to give yourself the best chance of responding and get the better outcomes because of targeting. We know that's the future of oncology, and that's what we've dedicated our work and our ecosystem to delivering. And so imagine having this detailed mapping, image-guided, minimally invasive procedures, direct-to-tumor, direct integrative agents supporting nutrition of the body, healing the body, treating the cause of the cancer. This is why the right DNA, the right RNA transcriptomics, the right spatial biology is so important to helping patients respond. Bottom line, precision testing, you get a map and you know what you need to do. The custom drug design gives you the correct smart combinations to help respond to the cancer, and then deploying it in the right treatment plan to get the impact you want without the side effects. This is the mastery of precision care. This is why these types of tests are important. This is why the drug design is important. This is why the planning is important, because not all genetic testing is equal. You need these multi-test components and drug design and delivery for it to be effective. And that's the key. I hope this was helpful for you to understand deep mapping and testing, why it's so critical. Drug design and planning and deploying of the medicines in the right way to help a patient respond. May the Lord bless you on your journey to healing.